Next, I'd like to call upon Kate Brown, who's the President of Parkinson's Australia. She's been Vice President of Parkinson's Victoria for 10 years as well. She's a medical scientist and had been a public servant and director of private companies. And her focus is on raising the profile of Parkinson's with both the community and government. Kate Brown.
Honourable Peter Dutton, Senator Carol Brown, Mrs Joanna Gash, members and senators, Dr Richard Peppard, Associate Professor Richard Bittar, friends from the parliamentary group, members of Parkinson's ACT, ladies and gentlemen. Parkinson's Australia thanks the organisers of this event for both the invitation and the opportunity to speak. When I first heard about this, I was intending to talk about a friend of mine who has had DBS, but then I noted that I was down to speak about PA and the role of PA, so I thought I'd better stick to the agenda. Parkinson's Australia is formed by all the Parkinson's associations around Australia. So there are 6 state associations and 1 in the ACT. Northern Territory is yet to form an association. Parkinson's Australia aims to advocate on behalf of all people across Australia with Parkinson's and to do this advocacy in the federal arena. The state associations, many of which are run entirely by volunteers, provide education and support to people with Parkinson's and their families. Today, across Australia, 25 people will find out that they've got Parkinson's. Many of these will retire early, and so will their carers or partners, leading to a loss of social connectedness, income, and for the early onset, this may well be at the peak of their career. Parkinson's is a complex condition. It is difficult to diagnose, and it requires a team of skilled health professionals, the neurologist, the Parkinson's nurse, the physiotherapist, the speech therapist, to provide the education and support needed to enable the person to manage their condition, whether they're using drug therapy or DBS. Parkinson's Australia is acutely aware that this level of support, this required level of support, is only available in selected suburbs of capital cities. And that this level of support, that is the only place that level of support is readily available. So I want to share with you my vision since I was recently appointed as President of Parkinson's Australia. When I came to the role, I thought, where do we want to be? And at this stage, where we want to be in 2020 is that there is Australia-wide recognition, both at the community and at the political level, of the impact and the needs of people with Parkinson's. A level of recognition similar to those people who, say, have diabetes. By 2020, there will be, if I have my way, 200 Parkinson's nurses employed across Australia, meeting the education, treatment management and support needs of people with Parkinson's. An appointment at a multidisciplinary movement disorders clinic will be readily accessible to all people with Parkinson's. In some cases, yes, it may be a virtual one via telecommunication at their GP surgery. There will be in 2020 a young onset resource centre that provides the forum for information sharing, education and support looked for by that group. Training in Parkinson's will be regularly provided to all staff in aged care facilities. And a campaign to indoctrinate, and I use that word purposefully, hospital and aged care staff on the importance of people with Parkinson's getting their medication on time is delivered annually. Respite care by staff competent in dealing with Parkinson's needs will be readily available. The NDS will exist, and there will be an Australian Parkinson's Research Foundation. As some of the first steps towards that vision have started. Thanks to Senator Carol Brown, you have heard about the project at Shoalhaven, for which we're very appreciative. And you've heard about the report from Dr. Simon Lewis on that project, which is proceeding very well. But we already know from localities where Parkinson's nurses already practice that a nurse who has the skill and the time to work with people to better manage their medication and their symptoms and to educate other medical and allied health professionals and aged care staff results in people with Parkinson's staying at work longer, at home longer, minimises falls, thus lowering hospital admissions and delays the need for nursing home beds. To illustrate my argument, let me briefly refer to my friend that I was going to talk to you about. We are of similar age and have had similar life paths. For my friend, her path became complicated in her late 30s when she was diagnosed with Parkinson's when she had a young family. During her 30-year journey with Parkinson's, she has had to learn to manage many different medication regimes, including an external infusion pump. And then in her 60s, she had DBS and she had to learn how to manage that. What I noticed during that stepping beside her has been the range of health professionals she has needed. Physios, occupational therapists, speech therapists, but the most important has been the Parkinson's nurse, who has helped to educate her in how to manage the various medications or treatments that she has been on. What saddens me and incites me to raise my voice is that many Australians living with Parkinson's cannot access the full range of treatment options, be it due to expense or to distance, nor can they benefit from the education and support provided by a specialist nurse. With help, my friend managed her condition to suit her life rather than let her condition manage her. All Australians with Parkinson's should have that right. So on behalf of Parkinson's Australia, I congratulate the people who've developed this DVD, and because education, as was mentioned earlier, is power, and people need to have the knowledge to make informed decisions. But in closing, I ask each of you to help spread the word and to help make the vision of Parkinson's Australia a reality. Thank you.